As you all know, there's a lot of compliance deadlines coming up. So we wanted to make sure that you have all of the information that you need to be able to comply with those deadlines and give the most accurate information that you have. So today's topic is OSHA's record keeping standard. A little bit about Relion. We are located throughout Eastern Iowa in Iowa City, Iowa Falls, Kelowna, Muscatine, Victor, and Williamsburg. And we offer a wide array of insurance products, including personal lines, home and auto, as well as commercial property liability, auto and work comp, financial services, so things like group benefits, individual health, and dental, et cetera. And we also have value-added services, so claims administration, human resources, and then loss control services. I've been doing this type of work for about 7-8 years now, providing risk management services to commercial insureds throughout Eastern Iowa. The thing I love about my job is just building those relationships with you all through delivering these value-added support and services, and as well as helping you reduce your claims through risk analysis, just general risk management, training your employees, et cetera. I do help employers develop programming for our clients, including OSHA and DOT compliance. Those were the two main topics we've seen these last couple of weeks, as well as just general safety and workers' compensation best practices, with the overall goal of reducing your risk and helping you save the cost of insurance. I'm also an OSHA certified outreach trainer. I think many of you have employees attending some of our upcoming trainings. And I'm involved with local safety professionals organization. So today we're going to be talking about OSHA's record keeping rule, why it's there, what its purpose is, reviewing those rules that OSHA has set forth for employers to comply with. There are electronic reporting requirements. It has a deadline coming up March 2nd, so we'll kind of dive into that a little bit. And of course, we always like to share any assistance and resources that we can offer to our clients related to these topics. The purpose of the record keeping standard is really to require certain employers to collect injury and illness data and report it to the government. Could be OSHA, could be the Bureau of Labor Statistics. These records provide the baseline data for the Bureau of Labor Statistics in surveying occupational injuries and illnesses, which is the Bureau of Labor Statistics is the nation's primary source of gathering this information, and the OSHA logs kind of fall under that. Records can be used by OSHA to set forth new standards, realize where they need to focus their inspection efforts, as well as it really can help employers kind of drive your safety programming in reviewing your records and your incident rates, what we'll talk about later. That can really kind of guide some of the work that you need to do internally in reducing injuries and staying OSHA compliant. One thing that I would like to also note here is that just because you record or report a work-related injury, illness, or even fatality, it doesn't really necessarily mean that the employer or the employee was at fault or that anyone violated an OSHA rule. It's just, one of the things that I always try to keep people to remember when we're talking about this is you need to separate workers' compensation. So do you have a workers' compensation claim separate from this OSHA injury and illness record keeping? Because something could be a workers' compensation claim, but not necessarily an OSHA recordable and vice versa. Okay, so I think that's very important to kind of put out there up front before we get started. So let's talk about who the covered employers are under the record keeping standard. Employers who have 11 or more employees in the last calendar year. So you might be small enough of a business where maybe one year you have 10 or fewer employees, and then another year that you have, 11, 12, maybe you're growing. You could have to record some years and not comply others. So I think that's important. So if you had 11 or more employees during the last calendar year, you are required to keep these OSHA logs unless you're part of a partially exempt industry, and we'll look at that here in a minute. The forms that we're going to use are OSHA forms 300, 300A, and 301. And again, we'll dive into those a little bit later. So as I kind of mentioned, there is a size exemption. So if your company had 10 or fewer employees at all times during the last calendar year, so in this case, we're talking 2020, you do not need to keep the injury and illness records that we're going to talk about today unless OSHA sends you a separate survey or the Bureau of Labor Statistics sends you a separate survey and asks you for that information. And I have had a couple of clients reach out so far this year and say, hey, I got this survey. What am I supposed to do with it? So that would be an exception to this rule. Again, the size of the exemption is based upon the size, the number of employees in the entire company. That includes your principals, your leadership, your office workers. It's not just your frontline day-to-day staff. It could include temporary employees, but the key there, and we'll talk a little bit about this later, is who you supervise on a day-to-day basis. You need to include that in the 10 or fewer or the 11 or more count. There's also an exemption for employers who, maybe not because of their size, but because of their industry. And we'll look at that here in a minute. So if you have fewer than 10 employees and you're not required to keep OSHA logs, you are still required to comply with reporting fatalities, amputations, the loss of an eye, or inpatient hospitalization of your employees. Again, that's something we'll talk a little bit more about later. And again, there's that you may be asked or specifically requested to do that by OSHA or Bureau of Labor Statistics. So the reason that Bureau of Labor Statistics might send you a survey is they're trying to gather this data and determine what industries they need to or need to not exempt from this. So several years ago, they added automobile dealerships to the list of employers that were required to manage these logs. They used to be an exempt industry, but by doing these surveys and gathering this information, they realized that they were more frequently experiencing injuries and wanted to continue to monitor that. So here's a look at the industry exemption. This is what OSHA would classify as lower hazard industries. So you'll see here that on the left-hand column, there's two columns on each page. The smaller the NAICS code, it's very important that you understand what your NAICS code is or your industry classification, not only to understand if you have that exemption for keeping OSHA logs, but as well as comparing yourself using your incident rate that we'll talk about later to people who do what you do. People often ask me, well, where do I get this NAICS code? How do I understand my industry classification? Typically, if you have a Iowa unemployment account as an employer, you can go to your account, log in, and I believe it's under your account information. They should have you classified in an industry and we'll have that NAICS code. That NAICS code is typically going to be 6 digits long, whereas under other motor vehicle dealers, that first one there, the other 2 digits is going to get a little bit more specific. So it could get down to snowmobile dealers, implement dealers, those types of things. So that's where those last 2 digits are going to get much more specific for your operations. So covered employees, we just talked about covered employers. Now we're going to talk about employees that are covered. And those include things like any employee on your payroll, also employees that are not on your payroll who you supervise on a day-to-day basis. That's going back to those temps that I mentioned before. So if you are an employer that generally uses temporary employees, staffing agencies, et cetera, if you are supervising, if you're directing those employees day-to-day work, those are employees that you would need to include on your OSHA injury and illness logs. Now, typically the temp agency is going to cover that workers' comp claim if there is one. But for this purpose, for injury and illness record keeping, those temp employees, if you supervise and have day-to-day control over what they do, then you would need to include them. People who are self-employed and or partners, you can exclude them from the OSHA logs. And then again, temporary agencies should not record the cases unless they have a person in that organization supervising those employees. Okay, next we're going to talk about recording criteria. So what types of injuries and illnesses, when do you need to record these injuries and illnesses? So covered employers, we just looked at those, must record each fatality, injury, or illness. That is a work-related case. It's a new case. So if an employee has completely recovered from a very similar injury to a similar body part, and you have documentation from a provider that they had completely recovered, if they have a new injury, you would determine that as a new case. And then also if it meets one or more of the criteria that we're going to discuss next. So this is the overall process that you're going to consider in determining if something needs to be recorded on your OSHA logs. So the work environment is defined as the establishment or other locations you have. So your physical office where you direct activities out of, or other locations, job sites, maybe you have satellite offices, those types of things, where one or more employees are present or working as a condition of their employment. So you're directing them what to do. Now, there are some exceptions here to the work environment. So, for example, cases meeting these conditions might be exceptions to the work environment. If you're a grocery store employee and you're shopping in the store after work, if you fall and are injured, the employee is present as a member of the general public, and the case would not be considered work-related. Additionally, if an employee has a diabetic episode and must be given prescription medications, diabetes is solely due to a non-work-related event or exposure, and it therefore is not work-related. So regardless where the signs or symptoms surface, a case is work-related only if a work event or exposure is the cause of the injury or illness. Employees passing out, maybe you have a voluntary wellness program, maybe you have a blood drive going on. If the employee is part of a voluntary wellness program, medical evaluation, fitness, recreation activity. So if you have a blood drive and they're giving blood and they pass out, or if an employee is playing basketball and is injured, if you have those type of facilities, those are not considered work-related. If an employee is preparing their lunch and they burn their lip on a cup of hot coffee or chokes on a sandwich, again, that is something that would be not considered work-related. More exceptions, so personal tasks assigned outside of working hours. If you are let's say a metal fabricator, and you have employees coming in to do their own type of work on the weekends or outside of working hours, maybe somebody is making a fire pit for themselves, and they injure themselves there, that would not be considered work-related because it's outside of their working hours. Any personal grooming, self-medication, non-work-related condition, or anything that's self-inflicted would not be considered work-related, nor would a motor vehicle accident in the parking lot or access road during an employee's commute. Common cold and flu is not considered work-related. We will address COVID later because that kind of changes things a little bit, but I have a whole section dedicated to that. And then mental illness, unless if an employee claims that they received mental distress through work, that would be pretty tough to prove. You'd have to have a physician or a licensed healthcare professional with appropriate qualifications make that work-related determination. Sometimes you have employees that are traveling, even if it's to a job site out of town, or maybe they're going to a conference. An injury or illness that occurs while they're on travel status is not work-related unless the employee was engaged in work activities in the interest of the employer. So, for example, if I go to a conference in Des Moines, a safety conference, and my employer tells me to take a client out for dinner, he is directing me to do that activity. So if I'm injured or experience an illness, could potentially be work-related. However, if I go out on my own, see a friend, whatever that might be, that would not be considered work-related. When you're traveling, if you're in a hotel, that's considered your home away from home, as well as if you take detours for personal reasons, that would not be work-related. Working from home, when a few years ago, when I would give this presentation, this really wasn't something that was very relevant at the time, but this is now a timely subject. So employees that are working from home, a case would be work-related if an employee becomes injured or ill while working for pay or compensation. So for example, cases are not work-related if they are related to the general home environment. If an employee drops a box of work documents and injures her foot, that case would be considered work-related. However, if they trip over the family dog because they're swapping out laundry in between work tasks, that would not be considered work-related. Again, now remember, you have to take the whole workers' compensation piece out of it. If one of these examples happened, the workers' compensation claim, the compensability would be a separate determination based upon a number of factors. Okay, so now we're going to talk about days away and restricted cases. So first, you've made the determination that the case was work-related because it happened in the work environment, doing work activities directed by the employer. Now we need to look at the rest of the recording criteria. So OSHA says that if an employee has an injury that involves one or more days away from work, it is recordable. You'll check the box for days away cases and count the number of days. And I'll go into a little bit more about that here in a minute. When we're counting the days, it's important to remember we do not count the day of the injury or illness. The reason for that is that if you think about an employer that had an employee that was injured at 8 a.m. and another employer that had an employee that was injured at 4 p.m., we want to level that playing field because why would one employer have to count the whole day when the other guy was nearly done with his job when he got hurt? So I'll say a little bit more about that later, but we don't include the day of the injury or illness when doing the counting. Restricted work cases, you want to record that case if it involves one or more days of restricted work or job transfer. Again, check the box for restricted transfer cases and count the number of days, not including the day that the injury or illness occurred. A little bit more on restricted work cases. A restricted work activity is when the employee is unable to work the full day that he or she would have otherwise, or they're unable to perform one or more routine job functions. So an employee's routine job functions are those things that they would normally perform once per week. So if your shop manager's job is to sweep out the shop once a week and they can't do that, that would be considered a restricted work case. A case is not recordable as a restricted work case if the employee experiences minor muscle discomfort or where a healthcare professional has determined that they're fully able to perform all of his or her routine job functions, as I just mentioned, or if you assign somebody, if you as the employer assign somebody a restriction to prevent a more serious condition. So in the case of carpal tunnel, if you've got somebody that's experiencing discomfort and you move them temporarily or part-time or whatever that might be into another position, that would not be recordable. A job transfer is if an injured or ill employee is assigned to another job other than his or her own for part of the day. And if they perform, a case is recordable if the injured or ill employee performs his or her routine job duties for part of the day and is assigned to another job for part of the day. So more about counting days. I think this is important to remember, and I'll explain why here in a minute. So we always remember we don't count the day that the injury or illness occurred. Then when you're counting days, you need to count the number of calendar days, every single day on the calendar that the employee was directed, and I'll say more about that, to not work or be on restrictions. So for examples, that includes weekend days, it includes holidays, it includes any vacation days that they were scheduled. The reason for that is that a lot of employers have to qualify, or through the bidding process, they have to submit their incident and or DART rates, which is days away restricted transfer. And when that happens, we want to make sure that everybody's on the same level playing field. So we're all counting the same number of days. We're not counting that initial day. And then we're all capping at the 180 days. Because if we didn't have these in place, then some employers would have extremely high incident rates for seemingly the same injury, because different physicians may direct or have different opinions for what an employee, when an employee might need to have days away or restrictions. So the other thing that's important too is if there's a medical opinion that exists from a licensed healthcare practitioner, the employer must follow that opinion. So for example, if I'm out and about doing my job and I slip at a client and I roll my ankle and I go seek medical attention and the doctor says, you'll be fine, just put it up for the night, ice it, elevate it, and you're fine to go back to work tomorrow. If I decide the next day as an employee that it's just too sore for me to do my job and I decide I'm going to take a sick day or stay home, that's not considered a day away for your OSHA log purpose, because the doctor said I can and should go back to work. Okay. So if there's an opinion that you follow the medical opinion or the doctor's directions on counting days away or job restricted or transfer, excuse me. Okay, so if you do not have a work-related case that includes days away or restricted transfer, now we need to look at whether or not that employee received medical treatment. Medical treatment is the management and care of a patient to combat disease or disorder. Again, medical treatment does not necessarily include visits to a practitioner. It depends on what the outcome is, what they did or how they directed that employee for care. So for example, it does not include visits solely for observation or counseling. I could go to a clinic because I have a really bad cut, and it depends on what they do there. So if they give me stitches, that's considered medical treatment. But if they decide that they're just going to bandage it, that it doesn't warrant stitches, then that's just first aid. And I, as an employer, don't have to put that on my OSHA logs. It also doesn't include diagnostic procedures. So anything like an X-ray, blood tests, MRIs, again, it depends on the outcome of those things. So for example, an X-ray, if I do have a broken bone, if I do need to be put in a cast, then that would be considered recordable because I received medical treatment. But if that X-ray came back and said, I have no broken bones, I don't need to be in any type of a hard cast, then that doesn't need to be counted as a recordable. The other thing I'd like to mention is, and this trips people up quite often, use of prescription medications. If they are being used for diagnostic purposes, that's not considered medical treatment. So for example, if a doctor is giving me prescription eye drops to dilate my pupils to do some of those diagnostic procedures, that's not considered recordable. But if they give me a prescription medication for my eye because I have an infection due to a work-related incident, then that would be considered medical treatment. So let's look at some things that would be considered first aid. Using non-prescription medication at a non-prescription strength. So for example, if I have an injury and I go to seek care at the local occupational health clinic, and they tell me to take 800 milligrams of ibuprofen. Typically, I think the general consensus is, there's always a debate when I teach this class. I think the general consensus is that 800 milligrams or more would be considered prescription strength. So if they, and that's why it's important to help communicate with your occupational health clinics that you work with, and let them know that you're required to keep recordables. And so in a case like this, they might prescribe 600 milligrams of ibuprofen to help keep those recordables off your OSHA logs. Tetanus immunizations are considered first aid and therefore would not be recordable. Things like cleaning and flushing surface wounds, for cuts, things like wound coverings, steri strips, those are just considered first aid and are therefore not recordable as well. Again, in the example I used, using hot or cold therapy to help with swelling, that's considered first aid. Non-rigid means of support. So for example, if an employee is given an ACE bandage kind of to wrap around a wrist to help support it, that's different than a more rigid boot. So for example, here's just more examples of first aid. I do have some documents that are really good quick reference guides that can really help you determining whether, depending on the nature of an injury or illness, whatever that outcome was or is, can help you determine if we're talking first aid or medical treatment, which is, again, the difference between recordable and not recordable. Other possible recordable events, and what I would do here is I would absolutely consult with somebody, myself, for example, if you have these, whether or not they're recordable. So, for example, loss of consciousness, if an employee is diagnosed with an injury or illness, cancer, based upon some exposures in the workplace. So, for example, asbestos, silicosis, those types of work illnesses that could come about. A punctured eardrum, cracked tooth or bone, those are also recordable events. Work-related needle sticks and cuts from sharp objects that are potentially contaminated with another person's blood or other bodily fluids, those would potentially need to be recordable. And then hearing loss, if you are in an industry or an environment that, based upon noise monitoring that you've done, you have to conduct annual hearing exams. If you have employees that experience a standard threshold shift from that, then that needs to be logged on your OSHA log, as well as tuberculosis, which is not very common. Okay, I'm going to stop here and check out the chat board and see if I can have any questions to answer. Yes, this presentation will be sent out to all participants after the call. Great question. Lori, if I have an employee that experienced spasms in his back and was off work for a couple of days, after his MRI and exam showed no other issue but strained muscles due to improper lifting, how do I record that? Okay. You know what, Lori, I think the best way to handle this one is maybe to give you a separate call, because I have lots of questions. So for example, were they directed by a healthcare provider, that kind of stuff. So it looks like the MRI showed no other issue. So my question would be, again, were they off on their own or were they directed to be off? Lynn, our employees carpool in a personal vehicle and are in an accident and are injured. Is this work comp? Again, and Lynn, I'll reach out to you specifically on that one as well. That is more of a work comp question, as you referred to there. So I'll reach out to you on that one. Next, we're going to talk about the OSHA record keeping forms that y'all need to be aware of. That includes your OSHA 300 form, which is your log of work-related injuries and illnesses, the 300A, which is your summary, and the 301, which is your injury and illness incident record and report. So here's just a quick look at the forms, and I'll give you some tips and pointers on each of these. So the 301 form captures the data on each injury and illness. So you should have one of these on each injury and illness. Again, some of these might not turn into workers' comp claims, but documenting them is very, very important. But what I will say about this is OSHA says that you can also use your workers. This is where I contradict myself when I say keep workers' comp and OSHA separate. OSHA says that you can use your workers' compensation first report of injury form or any other company form that you've created as an equivalent form to this, but it just needs to make sure that it has all of this information on it. And I do know that the first report of injury workers' comp form does collect all of this data. So basically what they're saying is you don't have to duplicate your efforts as long as you've got this information documented on a form that gathers this information, that is enough. And most of the employers I work with don't keep this as a separate form. So this is the log. So this is what you're going to use throughout the year to manage and record your work, your OSHA recordables. I think it's important to know a couple of things. At the beginning of the year, when you start your new log, I would enter in the year, the establishment name, and city and state. That way, if you're asked for them on the fly, it is apparent that you have already begun work on that log for the year. A couple of things on this form. The very first column, column A, it says record the case number. You can apply any number that you would like to that. It could be a 1, 2, 3, 4, 5. It could be the year and a letter. It could be employee's ID number, whatever works for you. That's entirely up to you. You'll record the employee's name that was injured, their job title, the day of the injury or onset of the illness, where the event occurred. So you'll see the example up here, loading dock north end. When OSHA's reviewing these, or the Bureau of Labor Statistics, they want as much specificity as possible, both in where the event occurred, as well as column F when you're describing the injury or illness. You'll see there it says describe the injury, illness, the body part affected, what object or substance injured the employee, etc. So for example, describe the injury. Did they have a burn? Was it a sprain? Was there a fracture? If somebody has two of something, so a right and a left, indicate which one it was. And then if they have multiple digits, like our fingers and toes, indicate that it was the right thumb or the left index finger. Because as I mentioned in the beginning, OSHA uses this stuff to kind of guide, it's just really good data collection, and they use it to guide their efforts, their inspections, that type of stuff. So what I've heard an OSHA inspector say to me before, and say to an employer before, is they should have a really good picture of what happened based upon what you record in this particular column. Now, having said that, there's not a lot of room to write or type, but we do have some resources and ways to manage this that can help you get as much information as possible. Next, you're going to classify the case. So you always want to classify the most serious outcome. So for example, death is the most serious, but we're only going to check one of these boxes. So you might have an employee that has both days away and job restriction or transfer. The days away is going to be the most serious outcome of that. So you'll just select days away. However, if they do experience both, you'll enter the days away and the number of days that they were on restriction. Okay, so it's one of these, but both of these. And then we're going to check the type of injury or illness. So you have a lot to choose from over here. Probably I would say the vast majority of you, most of the time, will just check the injury box. But we also do have skin disorders, respiratory condition, poisoning, hearing loss, and then all other illnesses. Here's your summary form. So if you're using the right platform or tool to manage your OSHA logs, a lot of time this stuff will automatically calculate and populate over for you on the 300A form. But at the end of every year, at the end of every calendar year, you're going to fill in this stuff in the right hand box. Again, your establishment name. There's your NAICS code again. You don't have to do the standard industry classification, I think, or the SIC code. I think we're kind of going away from that. OSHA is going to compare you on your NAICS code. So that's the one that's really important that you have. You can then include the industry description, put the number of average number of employees that you had for the last calendar year, and then total hours worked by all employees. Again, the information on this document is very, very important. This is the information that you're going to submit electronically to OSHA, which we'll talk about later. But this is also used to calculate your incident rates and your DART rates. So if you have, and I'll show you the formula here later, make sure that you are including as many hours as possible, legitimate hours as possible, that your employees worked last year. So for example, oftentimes I'll review these and find an employer that has a pretty significantly high incident rate. And when I go back and ask them, well, did you include your salespeople, your administrative or executive officers in those hours worked? Typically they're telling me they didn't, that they're just doing their frontline employees, et cetera. So again, we'll talk a little bit more about that later. More on the forms. If you do have a recordable case, you have 7 days within you receiving information that a recordable case occurred. Sometimes you don't know right away that you have a recordable case, but you have typically 7 calendar days to put that recordable case on your OSHA log. As I mentioned earlier, an equivalent form that has the same information is readable and understandable and uses the same information as the OSHA form can be used. So I use the example of the 301 form, but the 300 form as well. If you have an Excel spreadsheet that you've created that has all of that same information, you're more than welcome to use that. And they can be kept on a computer as long as they can be produced when asked for them. The annual summary, we're going back to the summary form. Review that information on the 300 form for completeness, for accuracy, correct any deficiencies. Then you'll complete this 300 form and you're required to certify the summary and post it. So when you're certifying the annual summary, you need to have a company executive do the signing here down at the bottom. An officer of the corporation or the highest ranking official at that establishment or his or her supervisor. Employers are then required to post this if you are a covered employer, which we talked about earlier, from February 1st to April 30th of the year following the year covered by the summary. So for 2020, February 1st to April 30th of this year, if you're a covered employer, you are required to post just the summary detail. So just this page, the Form 300A. Oftentimes I'll do walkthroughs for employers and see the 300 log detail posted. Don't want to post that. We just have to post the summary. Okay. You see no more questions or no current questions. A couple other requirements I wanted to make everybody aware of that you should retain these forms in their entirety for 5 years following the year that they cover. So you want to be able to go back 5 years. So for example, if you were getting an OSHA inspection, they're oftentimes going to ask for this information. So make sure that you have 5 years worth of OSHA logs going back. If you have any change in a status to an injury or illness that occurred, maybe you would need to add additional days away or additional restrictions or something. Maybe an employee had restrictions in the beginning and then they had days away. During that retention period, if something changed, you only have to update the 300 form. There's no need to update the summary or the first report of injury form, just that 300. And you can cross it out, write the correction, whatever that might be. So I have a couple questions here, or one question. Where do you post the 300A? So the summary form. I typically tell employers it needs to be something that is accessible to employees. So I typically tell them wherever your time clock is, wherever your labor law posters are, is typically, wherever you post employee announcements is typically a good place to post those. This just says that if you're asked to by Osha or NIOSH, if you're getting an Osha inspection, as I mentioned, they're most likely going to ask to see your Osha records, your Osha logs, summaries, and so on. And you have typically 4 business hours to present those. And we tell people that you have the business hours of the establishments where the records are located. So if you have an inspection at a job site in California and your records are located in Iowa, you would use the business hours of Iowa to start counting. So employers are required of any size. So this 10 or fewer employee exemption does not exist. I think I've had several employers that have had to report and they had fewer than 10 employees. Employers are required to report fatalities, any work-related fatality, within 8 hours of it happening. And if you have a work-related fatality, I promise you, you will get an OSHA visit most likely that same day, or depending when it happened, it could be the next day. You're also required to report within 24 hours any work-related amputation, loss of an eye, or inpatient hospitalization of 1 or more employees. And that's typically the one that I'll see, and I'll help employers with that reporting process, that type of stuff. But you don't need to report a highway or public street motor vehicle accident if it happened outside of your construction zone. And you also don't need to report train or bus accidents. Iowa has a state-run OSHA plan, which means reporting, if you're required to report any of these, reporting needs to happen at the state level, state of Iowa, not the feds. So here's that information. You can either do it by calling their office. You can visit them in person if you'd like to drive to Des Moines. I wouldn't recommend that. Or you can submit an incident report form, which is what I always recommend. So if you go out to the OSHA at iwd.iowa.gov, that's the Iowa Workforce Development website, you can find that incident report form, and you can either email it or fax it. And I always recommend that you do that. That just gives you the opportunity to put as much information, but not any too much detail. We don't want to give them too much about the incident that occurred. Most likely they will give you a call if you've had any of these within 24-hour injuries, so amputation, loss of an eye, etc. Oftentimes they'll give you a call first, or they'll just show up to the job site or your office. It just really depends. And I always tell folks, you know, if you're in the Iowa City, Cedar Rapids area, typically OSHA inspectors will get their instructions the morning when they report to the office, the Des Moines office in the morning. So think about, no matter where you are in Iowa, think about how long it takes to get from Des Moines to where you're located. That's typically about when you might see OSHA show up if you've had to report any of these incidents. I don't see any current questions. Okay, electronic submission. OSHA requires certain employers to then report their information from their injury and illness records to OSHA by March 2nd each year. So again, this is just going to be your summary data from the 300A form for the previous calendar year. That's what needs to be reported. The affected establishments include any employer that has 250 or more employees, as well as employers that have between 20 and 249 employees and are also in what OSHA considers a high-risk industry. I think I've got something we'll take a look at here in a minute. Employers that would otherwise be exempt from this requirement must report that information. Again, if you receive a letter from OSHA or the Bureau of Labor Statistics to do so. OSHA does collect this information on injuries and illnesses to identify, as I mentioned earlier, emerging hazards, to characterize areas of concern, to target inspections, and other initiatives by OSHA. So for an example, let me go back to it. Here's an example of what they would consider high-risk industries. This again is where it's important to know your NAICS code. These are industries who are required to submit if you fall under the 20 to 249 employees. So this is opposite of the exempt list that I showed you earlier. So if you're in any of these NAICS codes or industries and you have between 20 and 249 employees, you're required to submit that summary data to OSHA by March 2nd. And I'll come back. I did want to share this never mind. I think I had a rogue slide in there. Sorry about that. So how do you submit this information? Well, you'll go to this website, www.osha.gov/injury reporting/ITA. So they have a platform set up for employers to submit this information. It's really intuitive. It's really quite slick. I don't think they're going to ask you any questions that you don't know the answer to. So this is, you'll either log in or create an account, depending if you currently have one. If you're new to this platform, you may have to set up some company information or establishment information if you have multiple locations. And then you'll just enter the data from, again, your 300A form. Again, it's pretty easy to do. I don't believe that they're going to ask you any questions that you don't know or can't get the answer to. Based upon this information the submission information that OSHA is gathering, I think I mentioned they use it for a number of factors. And one of those is to create policy and to direct what their inspections are going to look like for the coming, usually they're 1 or 2 years out. So OSHA, we call them directives. They're written statements of policy on a single subject, and that's going to guide their inspection efforts. So OSHA put a new directive out just last month, and what that says is that they are implementing a SST, stands for strategic target. I can't remember what the other S means. It's a strategic targeting program. So they're saying, here's where we're going to target our efforts for the coming years. Now, what's important about this is they're using employer submitted data from your 300A form for the calendar years of 2017, 18, and 19. So they're going to look at those 3 years. The other thing that's important to know, these are for non-construction workplaces. So my construction folks on the phone, you can kind of take a deep breath or a sigh of relief there, because they're going to focus on you for other hazards, some of those reporting, amputations, hospitalizations, that type of stuff. They're already directing those activities. So for non-construction workplaces that have 20 or more employees, and you're required to submit that information, they are going to look at inspecting employers that have high incident and injury rates. So that they're going to be checking that information that's submitted out there. And what they consider a high incident or injury rate is, again, they're going to compare you using that NAICS code to everybody that does what you do. So for example, if your industry has an incident rate of, I'll say 3.5, that's 3.5 injuries for every 100 employees for that year. If your incident rate is a 5.6, you're creeping up there compared to everyone else who does what you do. And if you're, 7, 10, whatever that might be for incident rate, you're probably going to get on their radar. You're probably going to get flagged and could possibly get an inspection. And we'll talk a little bit more about incident rates here shortly. How are we doing on time? Okay, we're going to talk about record keeping in COVID. And I know a lot of you are very intrigued by this. Unfortunately, the bottom line is COVID doesn't change any of the record keeping requirements. And I'll say a little bit more about that, but that's really the bottom line. You need to determine work relatedness. Did they have days away, job restrictions? Did they have medical treatment? That type of stuff. But I will tell you that OSHA has indicated that COVID-19 infections are recordable injuries if they are work-related and meet the ACTS recording criteria that we just went through. Again, days away, restrictions, medical treatment. Recording requirements only apply to employers, again, with 10 or more industries who are not in an exempt or low risk industry. So let's take a look back at that. Employers are only responsible for recording COVID cases if all of the following are met. So you have a confirmed case of COVID-19. That means you have an individual with at least one specimen that has tested positive for the virus that causes COVID. You then determine that the case is work-related, again, using the criteria that we just talked about. And then that case involves one or more of the recording criteria that we talked about. Medical treatment beyond first aid, days away from work are some examples. OSHA also issued guidance for its compliance officers that says that they recognize that in areas where there is ongoing community transmission, employers might have difficulty determining whether workers who contracted COVID did so due to exposures at work. So then this summer, they clarified that employers in the healthcare, emergency response, correctional institutions, those type of industries, those are really the only ones that really need to make that work-relatedness determination as required by OSHA regulations. So what does that mean? You need to have, according to the 1904, again, nothing is really changing. They're not going to enforce to require other employers to make the same work-related determinations, except where there's objective evidence that a COVID-19 case became or may be work-related. This could include, for example, maybe you have a number of cases that are developing among coworkers who work closely together. There's no other explanation on how they all contracted COVID really within the same time period. Or there's just evidence that's reasonably available to the employer. So, for example, there's reasonable evidence to include information given to the employer by employees, as well as information that the employer learns regarding employees' health and safety and managing their employees and business. OSHA compliance officers have been instructed to make sure that COVID is treated and coded as a respiratory illness. So if you'll go back to that OSHA 300 form that we looked at, the last set of columns there was a respiratory illness. If you've determined that you have a work-related, meets the criteria, COVID-19 case, then you will code that as a respiratory illness. You can code those as privacy cases on your log for any employee that makes that request. So all you would do instead of the name is you would write privacy case, and then if you're doing that, you want to make sure that you keep separate record of those privacy cases, who that employee is, etc. Reporting COVID hospitalization. So again, you still have to report hospitalizations and fatalities of employees if they occurred within these guidelines that we just talked about. So for example, employers are still required to report inpatient hospitalizations if it occurs within 24 hours of an exposure to COVID in the workplace. As a result, employers must report those hospitalizations only if they are for inpatient treatment and the results of a work-related COVID case. So again, this is turning us all into detectives, I think for the most part, in trying to determine the work-relatedness of this. . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . Fatalities, if you do have a, God forbid you had a COVID related fatality in your workplace, OSHA requires employers to report those that occur within 30 days of an exposure in the workplace. Just like a job site fatality that you might have due to an accident, you still have to submit that within 8 hours of the time that you learned that the fatality took place. So fatalities that occur within 30 days, you have 8 hours to submit those to OSHA. I know this can still be confusing. If you have any more questions, OSHA has really, really great resources. I can answer them one-on-one, but there's so many different types of industries out there. This might be more relevant to some of you than others. So if you have any really specific questions about what you do, I'm happy to answer those and kind of walk you through that. I would also like to note that there's some things that you can do as an employer to kind of help manage COVID in your workplace. And that's make sure that you're following all workplace safety guidance from OSHA as well as the CDC and local health authorities to minimize that risk of your employees contracting COVID on the job. But also familiarize yourself with the states that may impact their workers' compensation, which Iowa is not, has not really put anything out about that. So I wouldn't worry too much about the workers' compensation unless you have really specific questions on that. So again, familiarize yourself with OSHA's guidance on COVID, continue to monitor developments. It's hard to believe we've been hearing about this for a year now. And as you all know, things are changing constantly. Review your workplace safety reporting and recording policies to make sure that you are ready to respond if you do have any COVID issues in the workplace. Develop a policy and action plan and communicate that with employees. I did have a client this fall who had a couple of employees report them to OSHA saying that they weren't protecting their employees from COVID. And this employer, they had great documentation. They had developed a very detailed policy for different types of activities that their employees might be involved in and how they might, how the employer was protecting them from this. So make sure you've got really good documentation about your policies, response to emails, and if an employee has a concern. And OSHA did not even end up going out to visit them because they had really, really good documentation on their action plan, their policy, etc. And it's important to remind everyone that OSHA does have anti-retaliation protections in place, not only for reporting COVID concerns, but any workplace hazards and concerns. So make sure that you're not retaliating against your employees for reporting injuries or anything. Couple of ways that you can help avoid recordable or any injuries in the workplace for that matter. Make sure you have a good comprehensive safety program that you're training your employees. That includes training, it includes policy development, observing employees working safely. Just have that program. Make sure employees are aware of it as well. Inform your employees how to report those work-related injuries. Who do they go to? Have a relationship with an occupational health provider, or wherever you send your employees. It's important that they know, based upon what the work that you do, that you are required to keep these OSHA logs, and that if something could be bandaged versus stitched, and keeping that off of your OSHA logs, and in turn keeping your incident rate down. It's important for them to know that. Most of them are familiar with that, but if you're not, if you're outside of construction or manufacturing where it's very, very clear, they might not know if your industry requires you to keep OSHA logs. Maybe you're a community provider, maybe you're a nursing facility. So it's important that they know what your record keeping requirements are, and make sure that they understand what your employees do so that they understand that you have light duty, where yes, that'll go into your job restriction transfer days, but if we can keep both, it's good, both workers' compensation best practice as well as OSHA logs, keeping them out of the days away category is always good. Or if they know what your employees do and they realize that they can work even though they are injured, maybe we don't have to have days away or job restrictions. So having that relationship with your occupational health provider is really, really important. As I mentioned, know what your incident rate is and how you compare to others in the same industry. So the incident rate, you calculate it by taking the number of recordable incidents, so total incidents that you had in 2020, you'll multiply that number by 200,000. Again, we're using this number because we're leveling the playing field with everyone. Everyone's using the same information. And then you'll divide that by the total work hours that we saw on the summary form. Number of recordables times 200,000 divided by those total work hours, that gives you your incident rate. So it's really important that you know what your incident rate is, and you can find what that average incident rate is for your industry by going to the Bureau of Labor Statistics. I don't, unfortunately. If you go to their data and statistics page, you can find that for your industry. They have about a year to a year and a half lag time. So right now, I think they have 2019 data out there. They won't have 2020 data out there until, as you can imagine, they collect all this data from the submissions and determine what your industry average is. But know how you compare to others in your industry. So for example, I mentioned that OSHA is going to have a strategic targeting initiative where if you know that you're above the industry average, that really can help guide you and direct you in your safety programming to avoid those in future years and keep that incident rate down. And again, don't wait till January to complete your OSHA forms, manage them throughout the year. I have a former employer that I used to work with, and we would meet every January so she could do her OSHA logs. And she had a hard time getting her hands on the paperwork required or remembering how long this employee was off work or restricted for. If you're managing them throughout the year, it's just a really great best practice. I'm looking at, please, I'm starting to wrap up here. I'm just going to do a few closing slides. So if you have any final questions, please start typing those in the chat, and I want to make sure that we get those answered for you. We do here at Relion offer services related to what we're talking about here today. So for example, I'm happy to audit your OSHA forms before you post and or submit those. So we've got just a couple weeks left in the year. If you want me to take a look at those, I can certainly do that. I very oftentimes find things that are on those OSHA logs that are not recordable. Maybe they don't have the right boxes checked, that type of stuff. Maybe they're not accounting for all of the employee hours. So I think I can really provide some value for you in doing that. We have record keeping resources. We can consult with you. If you have an incident in June and you have to report that to OSHA, we can help guide you through that process. Even attending the job site inspection, if they do end up coming out to inspect, we can help you determine if something actually is reportable. So feel free to give us a call throughout the year. And then we do have Excel and PDF forms of the OSHA logs. Some of you are using OSHAlogs.com to manage your OSHA logs. It's a really great resource. However, we do have a great tool coming, I believe later this winter, early spring. We have a portal where you can not only manage your OSHA logs, so it's really just about a little bit of data entry, and then whenever you need it to, we'll spit out all of those forms for you. It's a great tool. It will calculate the incident rate for you. It will help you understand maybe frequency and severity of your incidents. So it will help analyze the types of injuries that you're having. Again, more information coming out on that here shortly. But this portal is also going to have some learning management system for you to conduct training for your employees. There's training PowerPoints out there, OSHA resources, as well as HR safety and other risk management topics. I'm really excited about this. I've used this with past employers that I've worked with. It's a really, really great tool. Again, watch for more information on that. And then just some other general services that we offer at Relion to our insureds at no charge to them. We can do employee handbooks and safety manuals, whether you need a new one or you just want yours audited, have another set of eyes take a look at them. Fork truck certifications, I've been doing a lot of those lately. Those are really, really important to have if you don't have those. OSHA will require fork truck operators, that includes telehandlers on job sites, to be formally certified. We can do safety training on site, or if you just prefer to do your own, we have materials for you as well. Lots of services out there. If you need something and you're not sure if that's a service that we offer, just give us a call. We can talk about that more. I'm going to go ahead and take a look. I've got a couple questions up here. Sherry asked, how long do you keep OSHA 300 posted for? That needs to be posted at least through April 30th. So February 1st through April 30th. Come May 1st, you can feel free to take that down. Some people leave theirs up all year. That's okay too. But at least through April 30th. Michelle asked, I had an employee receive an injury, but it was his last day at work for my company. He did require surgery a few weeks later. I'm not sure what happened from there through work comp. Michelle, I'll give you a call on that one. Sounds like there's a lot of specifics in that we might need to gather. Again, most of you have been, or many of you have been attending our FMCSA and DOT webinars this month. Our third and final one is on Tuesday. We're going to be talking about the basics and how to improve your CSA scores. A lot of great information in that one. So if you have a trucking or DOT exposure, please go to our website and sign up for that one. And then we've got an OSHA 10 coming up. I should have taken that off. That class is currently full. But if you have anyone in need of OSHA 10, let me know, and I'll keep you on a mailing list for upcoming events. That's all I have for today. I really appreciate your time and attention. I hope that you found something in this session valuable. And again, please feel free to reach out to me if you have any questions, if you need help on managing either the submission or the posting, or you need your OSHA logs audited.